okay?
Mm-hmm.
Usually TMB works as a better biomarker if you're using Nivo, and I don't understand why. Because in all of the Pembro trials, okay, basically if you pair Pembro with chemo, most of those trials are positive. You don't need any biomarkers to select for those patients. But for some reason, I don't know why, but Nivo seems to only work in the TMB high patients. And so I do think if you were to pair Nivo with IPI, you probably need TMB.
Okay, I see. But you're saying this will depend on what exact agent is used, as opposed to, so Nivo as opposed to another potential PD-1 inhibitor.
Right.
Okay. So TMB may not bring value for, say, another PD-1 or PD-L1 inhibitor out there.
That's my guess. But,
okay.
you know, a lot of the agents which are currently in development, they haven't really reported data yet, right? And so the ones that have had data reported most extensively are Pembro with all those keynote trials, and then Nivo, the checkmate trials. And then virtually a lot of the checkmate trials, they only demonstrate the benefit in the TMB high patients. Whereas if you extrapolate from non-small cell, you know, Pembro, basically you just like pair Pembro with like chemo. It tends to work. But you know, Nivo doesn't seem to quite behave similarly for reasons I don't understand why.
I see. And in the first-line setting, would durability of response with immunotherapy, is this a strong consideration for you as well? For example, with any of the IO chemo combinations?
Wait, so what's your question in the first-line setting, the IO chemo?
So is durability of response a driver of your prescribing?
Yeah.
So with,
definitely.
For example, if the addition of IO to chemotherapy demonstrates a more durable response, would that influence your prescribing? Okay.
Yes.
I see. So I want to talk about some of the limitations of these combinations. Do you think IO plus chemo has any, greatly raised toxicity that might limit its use in first-line extensive disease?
I would hope not. And then I don't know because I'm not involved in those trials. So I don't know what the toxicity profiles are. But if I were to extrapolate from the non-small cell lung cancer, when they added IO to a platinum-based regimen, you see more immune-related toxicity, but overall it was tolerable. So I would hope if you were to combine IO with EP, it would be something similar. Maybe you see more immune-related toxicity, but still still tolerable.
Okay, I see. Thank you. And what do you think about the combination of PD-1, CTLA-4, and chemotherapy? So a triple or quadruple, so a quadruple combination.
I don't know.
Obviously, there's a bigger bar then because the toxicity will be increased. But what do you think of the potential?
Well, you can certainly try it because we know PD-1 plus IPI already gives you more toxicity, right? In terms of the immune-related toxicity. If you were to add that to chemo, I don't know. You could do a phase 1 and see. I do think you can probably still accrue patients. But I really don't know. I think it's worth doing a phase 1 and just see if it's safe.
Okay. Thanks so much. So if one of the